Urinary Incontinence Part 2 Test and Diagnosis. It's important to determine the type of urinary incontinence that you have. That information will guide treatment decisions. Your doctor is likely to start with a thorough history and physical exam. You may then be asked to do a simple maneuver that can demonstrate incontinence. Close your mouth, pinch your nose shut and exhale hard. After that, your doctor will likely recommend urinalysis. A sample of urine is checked for a sign of infection, traces of blood, or other abnormalities. Bladder diary. For several days, you record how much you drink. When you urinate, the amount of urine you produce, whether you had an urge to urinate, and the number of incontinence episodes. Treatment and drugs. Treatment for urinary incontinence depend on the type of incontinence, its severity, and the underlying cause. A combination of treatments may be needed. Your doctor is likely to suggest the least invasive treatments first and move on to other options only if these techniques fail. Behavioral techniques. Bladder training. To delay urination after you get the urge to go, you may start by trying to hold off for 10 minutes every time you feel an urge to urinate. The goal is to lengthen the time between trips to the toilet until you are urinating only every 2 to 4 hours. Double voiding. To help you learn to empty your bladder more completely to avoid overflow incontinence. Double voiding means urinating, then waiting a few minutes and trying again. Scheduled toilet trips. To urinate every 2 to 4 hours rather than waiting for the need to go. Fluid and diet management. To regain control of your bladder, you may need to cut back on or avoid alcohol, caffeine, or acidic food. Reducing liquid consumptions, losing weight, or increasing physical activity also can ease the problem. Pelvic floor muscle exercises. Your doctor may recommend that you do these exercises frequently to strengthen the muscles that help control urination, also known as kegel exercises. These techniques are especially effective for stress incontinence but may also help urge incontinence. To do pelvic floor muscles exercises, imagine that you are trying to stop your urine flow, then tighten the muscles you would use to stop urinating and hold for 5 seconds and then relax for 5 seconds. If this is too difficult, start by holding for 2 seconds and relaxing for 3 seconds. Work up to holding the contractions for 10 seconds at a time. Aim for at least 3 sets of repetitions each day. Medical devices. Uteral insert. A small tampon-like disposable device inserted into the urethra before a specific activity such as tennis that can trigger incontinence. The insert acts as a plug to prevent leakage and is removed before urination. Peccary. A stiff ring that you insert into your vagina and wear all day. The device helps hold up your bladder, which lies near the vagina, to prevent urine leakage. You may benefit from a peccary if you have incontinence due to a prolapsed bladder or uterus. Surgery. Sling procedure. Strip of your body's tissue, synthetic material or mesh are used to create a pelvic sling around your urethra and the area of thickened muscle where the bladder connects to urethra. The slings helps keep up urethra closed, especially when you cough or sneeze. This procedure is also used to treat stress incontinence. Bladder neck suspension. This procedure is designed to provide support to urethra and bladder neck, an area of thickened muscle where the bladder connects to urethra. It involves an abdominal incision, so it's done during general or spinal anesthesia. Prolapse surgery. In women with mixed incontinence and pelvic organ prolapsed, surgery may include a combination of a sling procedure and prolapse surgery. Artificial urinary sphincter. In men, a small fluid-filled ring is implanted around the bladder neck to keep up the urinary sphincter shut until you are ready to urinate. To urinate, you press a valve implanted under your skin that causes the ring to deflate and allows urine from your bladder to flow. Artificial urinary sphincters are particularly helpful for men whose incontinence is associated with treatment of prostate cancer or an enlarged prostate gland. Absorbent pad and catheters, pads and protective garments. Most products are no more bulky than normal underwear and can be easily worn under everyday clothing. Men who have problems with dribbles of urine can use a drip collector, a small pocket of absorbent padding that's worn over the penis and held in place by close-fitting underwear. Catheter. If you are incontinent because your bladder doesn't empty properly, your doctor may recommend that you learn to insert a soft tube catheter into your urethra several times a day to drain your bladder. You will be instructed on how to clean these catheters for safe reuse. Thank you very much for watching this video. If you like this video, do click on the like button, share this video on Facebook, Twitter and WhatsApp, and don't forget to subscribe our channel. Thank you.